Hi, my name is Dr. Rudra, Mohan, and through the Oral Health channel, today we're going to be talking about stainless steel crowns. Let's start. So today I'm going to be talking about stainless steel crowns and other crowns for pediatric patients who require crowns for many purposes, such as if they have undergone the procedure of pulpectomy or pulpotomy, multi-surface caries restorations, carious lesions that cannot be restored with conventional dental filling materials, and on top of that, in cases of permanent molars as an interim restorations or any sort of financial constraints that might not be feasible for the parents to afford with terms of conventional restorations or crowns. So stainless steel crowns are generally given in patients, pediatric patients, around primary molars and primary teeth, and especially the permanent first molar, because it's the first permanent tooth to erupt in the oral cavity. Now the indications are very simple, as I've told, that any sort of pulpectomy, pulpotomy procedures, and these crowns are usually prefabricated metal stainless steel crowns which come in various sizes, and we have to try them out while the child is in the chair, and we have to see if the size fits, the best size fits or not. If the size is not fitting, we can add layers of metal and weld them together and crimp them down if the size is too big or small. So depending upon that, the procedure is done under local anesthesia, and all the carious lesions are generally restored beforehand. Also, let me tell you, for patients who have a lot of developmental defects such as amelogenesis imperfecta and dentinogenesis imperfecta, you might require that, because these teeth wear out very fast, and that's why you require crowns for that. For the permanent molars, it's actually very economical, and it can serve as an interim restoration, or if you require to maintain a space maintainer for an unerupted tooth. Otherwise, for a permanent first molar that has erupted but is partially erupted and not come up to its whole thing, you can place a stainless steel crown. And the procedure is very simple. You have to put local anesthesia, and then you can judge the size and then snap the crown with the help of your fingers, and you can place the cement between the crown and the tooth, and then you can let the cement set. Usually it's a resin modified glass and cement. There is also one technique which is known as Hall's technique, which is usually a preventative technique, and it basically does not require any anesthesia, where you don't prepare the tooth surface for the crowns. You just put separators between the adjacent teeth of the tooth to be crowned, and then you place the separators for 5 days, and then that gap is created, and you snap a prefabricated metal stainless steel crown, and this will not cause any sort of problems or any sort of pain. However, there are some really specific instructions for that. On top of that, you have to understand that there are new crowns in the market as well. You have open faced veneer prefabricated stainless steel crowns, where you place the crowns in the anterior regions, and because of the fact that they are stainless, you remove a part of the facing of the stainless steel, and then you put a resin or a composite restoration. That is because of the aesthetic compromise that can be created because of the fact the stainless steel crowns will show in the anterior region of the child's face. Now there are some other crowns as well. You have polycarboxylate crowns, you have pedo pearls, you have kinder crowns, so many other type of crowns are there. And you also have strip crowns. These are transparent crowns in which you can house the resin, cure the resin, and then strip the transparent covering, and that's where you will get very aesthetic, relatively aesthetic crowns which have a good fit and are resin cured. And lastly, you have zirconia crowns that can be placed. However, the only problem with zirconia crowns is the added cost, and that is definitely a prerogative of the parent if they would want to consent to these costly crowns. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message with your name, your location, and your common oral health problem that's giving you discomfort, and I will get back to you within a couple of days. If you have any queries, doubts, apprehensions, insights, or suggestions, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.